prion, PRP, is a protein located mainly at the neurons and helps them with the nerve impulse. The illness begins when the prion faults badly, PRPSC, and it makes that other prions do the same, forming a group that generates a transmissive spongiform encephalopathies. One of those is the Creutzfeldt-Jacob disease. According to the World Health Organization, it depends on the certainty of the clinical diagnosis and is divided into possible, probable, and definitive. Abnormal or absent electroencephalogram, unless two of the following: myoclonus, cerebellar signs, or visual disturbances, extrapyramidal or pyramidal signs, akinetic motives, duration of less than 2 years. Progressive dementia, typical electroencephalogram during illness of any duration, and or positive detection of 14-33 protein in cerebrospinal fluid, and clinical duration of 2 years until death, unless one of the following: myoclonus, visual disturbances, or cerebellar signs, extrapyramidal or pyramidal signs, akinetic motives. Neuropathological characteristics and or confirmation of protease-resistant prion protein PRP and or presence of scrapie-associated neurofibrils. It affects the cerebellum and the cerebral cortex in a period less than or equal to 6 months. Dementia is generated. The 10% of the Creutzfeldt-Jacob patients have this variant. They have more myoclonus and cognitive symptoms. Dementia appears before motor symptoms. The 20% of Creutzfeldt-Jacob disease patients have this variant. It is characterized by visual disorders like blurry vision, amanimus, hemianopsia, visual hallucinations, abnormal perception of shapes and colors, and cortical blindness associated with progressive dementia. Most cases of this variant occur in Japan and rarely in other types of ethnic groups. It is characterized by affections in the white matter and gray matter. Its clinical presentation has cortical and cerebellar symptomatology. It is characterized by a progressive variable initial muscle. It also has amyotrophic lateral sclerosis, which can be confused with frontotemporal dementia or Alzheimer's disease. The 5 to 10% of patients have this variant. They develop the disease with a more typical clinical presentation and in a longer time that can be 2 years. Patients develop the disease at approximately age 48 and have a family history of it. At the beginning of the illness, they show few myoclonus, behavior disorders, abnormal electroencephalogram, and intellectual abnormalities. It can be confused with Alzheimer or another degenerative illness. The medicine for this illness hasn't been discovered yet. There are a non-pharmacological treatment that help with the dementia symptoms. This is reality orientation therapy. This therapy was first described by W. and Folsom in 1966 and consists of reorienting the patient spatiotemporally through repeated exposure of orientation information, and the use of multiple external aids. In addition, Arroyo et al. 2012 state that this therapy can be performed individually with 24 hours or in group with classes, with equal success in both modalities.
Buenas tardes, son las 5 de la tarde, vamos a empezar nuestra sesión de terapia cognitiva. Yo soy Ceci, vuestra terapeuta. Vamos a empezar como lo hacemos todas las tardes, recordando qué día es hoy, ¿vale? Hoy es jueves, día 29 del mes de mayo, que es el mes de las flores, del año 2014. La estación del año, la primavera, de la sangre, altera. Y ahora vamos a ver dónde nos encontramos, ¿vale? Estáis ingresados en un hospital, ¿verdad, Concha? Hospital que se llama Aguas Vivas. Muy bien. ¿Y dónde se encuentra ubicado el Hospital Aguas Vivas? En el término municipal de Carcaixent, en la provincia de Valencia. Muy bien. Vosotros estáis aquí para acudir al servicio de rehabilitación en el que nos encontramos, ¿verdad? Estamos aquí abajo. Y está el servicio de daño cerebral, que dentro del hospital, ¿en qué planta decimos que está? En el sótano, que también le solemos llamar planta sótano o -1.
Even though initially these programs were created to Alzheimer's patients, they can help to the dementia component that has Creutzfeldt-Jacob Disease. This program is fundamented in the concept of neuroplasticity, the clinical vision of the dementia patient, the cognitive neuropsychology, and behavior modification techniques. The program has workshops where it is stimulated attention, language, calculation, knowledge, practice, and memory. Also, it has reminiscence therapy, kinesiotherapy workshop, music therapy occupational workshop, psychoexpression workshop, and maintenance workshop for daily living functions. Patients go to the program 5 days a week by 8 hours a day. It was designed by Franco et al. And is a multimedia system that uses technology to train and rehabilitate higher cognitive functions in patients with cognitive impairment. The program has tests to work memory, perception, attention, orientation, and calculation. The patient interacts with a touchscreen that provides visual and audible instructions that he or she must complete.